Are you experiencing neck pain or pain in the shoulder area, maybe the upper chest wall and the back? Maybe it radiates down your arm. You could be having a C5 or fifth cervical nerve root compression due to disc pathology or maybe a bone spur. And if so, I'm going to show you some tips you can do at home to try to alleviate your symptoms. Our cervical spine is made up of 7 vertebrae and 8 nerve roots that come out. And those nerve roots are these yellow pieces here that come out on the sides, and those go out to different parts of our body to supply motor functional movement and also sensory input, ability. And so what you can have happen is the disc, the intervertebral disc, can push out and compress those nerve roots. You can also have bone spurs that can come out, those pieces of what's called osteophytes, little pieces of bone or bony overgrowth, which is common when you have arthritis and other conditions such as spondylosis. That can come out, put pressure on the nerve roots, and then you're going to have these pain symptoms around the neck, shoulder blade, the arm. You may notice weakness being able to raise your arm out to the side. Also weakness flexing the elbow, such as making kind of a bicep or curling. You may notice weakness in those areas. Also pain that radiates down the outside of the arm. That can go to the forearm area. It could come down to your hand, but typically in and around the shoulder area and the shoulder blade area is the most common area. So we're going to go over some techniques to do at home to try to reduce your pain and improve your movement and mobility. Our first technique is just going to be a cervical traction and self-stretch. You're going to use a pillowcase. You're going to come in the base of the skull here, kind of in the bend of the neck. And what you're going to do is you're going to pull up through the eyes, kind of up towards the ceiling. And you can look up a little bit and just hold that position somewhere between 5 to 10 seconds. Pull back up again. Hold that position 5 to 10 seconds. Now they do make over-door traction units that you can purchase. They kind of fasten over the door and kind of come around your neck. They also make some that kind of pump up. There's different ones. They're pretty inexpensive overall. But if you don't have that, you can use a pillowcase or a small sheet, just something to hook behind the neck and to pull up to kind of open up the vertebrae a little bit, to take some pressure off the disc. Next, you're going to work on scapular retraction. I like to fasten the bands at pretty high for this. I just like that angle. And what you're going to do is pull down and back, really squeezing your shoulder blades together. Hold that for a count of 2 to 3 seconds and come back out. Pull back and down again. Hold for 2 to 3 seconds and come back out. You're going to repeat that for 2 to 3 sets of 10 to 15 repetitions. Next, we're going to perform shoulder abduction. We're going to pull the arms apart. At the same time, you're going to retract your cervical spine. So what you're going to do is take the band out in front, pull it apart. As you pull this apart, really squeezing your shoulder blades together, you're going to retract your cervical spine. So you're going to retract back on your cervical spine. So we're going to go back and retract, and then pull apart, back and retract. You're going to perform that for 2 to 3 sets of 10 to 15 repetitions. Now you're going to perform resisted retraction using the band. So you're going to put this behind the head, and then you're going to retract back, so kind of pull your chin back. And at the same time, you're pulling back against the band here. You're going to hold that for 2 to 3 seconds. So pull back, 2 to 3 seconds. And you're going to perform that for 2 to 3 sets of 10 to 15 repetitions. This is going to be a shoulder stretch and neck stretch. What you're going to do is grab the bottom of a chair. Just have a hold of the bottom of the chair here. I'm going to lean away. This is the side the symptoms are going down. I'm going to lean away. I feel that stretch in my shoulder. And then I'm going to take my hand and kind of put a little overpressure and stretch this whole side of my neck here. If that's too aggressive, you don't have to put the overpressure on the cervical spine. You can just lean away and just kind of tilt your head over a little bit. If that makes your symptoms worse, you want to avoid that. Sometimes that can cause the disc to kind of push out, compress on the nerve root more. You just kind of have to play with that and see. But sometimes, as long as it doesn't cause a lot of irritation, that stretch works really well. Now we're going to use a tennis ball. I'm going to put it in a pillowcase. And what you're going to do is you're going to take the tennis ball and put it on your back there in that scapular region or the back of the shoulder where you're having pain. You're just going to kind of lean into it. So I'm holding pressure against the wall just to kind of get a little bit of muscle relaxation or soft tissue release, whatever you want to call it. It just typically feels pretty good to lean in, especially in that painful area, even though the symptoms or the issue that's going on is not coming from that area of the shoulder blade or the back of the shoulder. It's coming from the cervical spine. A lot of times that pressure on that area that's been hurting, even though it's referral area, does really well at giving you a little bit of relief. Thanks so much for watching this video. I hope it helps with your C5 nerve root compression. Be sure and subscribe to my channel. That way you get all my information and content that comes out. Thanks again.